So question 27 reads, what is the patient at risk of? So here we have a 51-year-old male patient. His chief complaint is, I have been having some issues with my medication. His background or patient history is that he consumes 10 alcoholic drinks a week. He takes warfarin, and his current findings are an INR of. So warfarin is a medication that's used as a blood thinner. An INR is a test that we use that takes the ratio of tested prothrombin time over normal prothrombin time. A healthy value would be 1.1 or below, but for those taking warfarin like this patient, it's between 2 to 3. So here the INR is high. The patient here also consumes a lot of alcohol, which then decreases the metabolism of warfarin. So this means that warfarin would just be in the body for much longer than needed. It's not getting broken down. So the effects of warfarin are amplified and blood will continue to be thinned. Option A reads major clotting. So like we said before, warfarin is a blood thinner, and with excessive alcohol, it's just going to have increased effects, and the body's ability to clot would be decreased. So this would be incorrect. Option C reads infection. The patient is experiencing major bleeding, not infection, so this would be incorrect. Option D reads stroke. Again, alcohol consumption and warfarin is decreasing the body's ability to clot and thus increasing bleeding, so this would be incorrect, leaving us with option B, major bleeding. Because of the patient's increased alcohol consumption and warfarin intake, there will be increased bleeding, making this the correct answer for this question.
This question asks, which is the toothbrushing duration that is optimal for plaque reduction? According to the ADA, a general recommendation for all patients is to try to brush their teeth for 2 minutes, and this duration has been shown to reduce plaque in comparison to less time. This 2-minute duration means that time spent in each quadrant can be split evenly for 30 seconds per quadrant, making C our correct answer. This also equates to around 4 seconds per tooth. This means that options A, B, and D are incorrect, as we should not spend 10 or 20 seconds per quadrant, as this is too little time, and 40 seconds per quadrant, which is answer D, is a bit excessive. Instead, we should focus on spending 30 seconds per quadrant, or 2 minutes in total.
Question 34 states, a dental assistant developed signs of jaundice while working in a dental office. It was later found out that the dental assistant had come in contact with an acutely infected hepatitis A patient. What should the dentist do next? So for this, it's important for us to understand how hepatitis A may be spread and what occurs during infection. So hepatitis A may be spread by consuming infected food or drinks or by coming into personal contact with an infected person. Now, it can take from 4 to 7 weeks for someone to completely get over hepatitis A. It really depends on many different factors. So what should the dentist do in this circumstance? Well, looking at B, it states, terminate the dental assistant's employment immediately. This may be unnecessary because really what the dental assistant needs is a resting period to overcome the acute phase until the infection subsides. So B is incorrect here. Next, we're looking at option choice C. Overlook the dental assistant's condition and let her continue working with medicinal support. So although the support is there for the dental assistant, it's really a risk to have her continue working because she may spread the infection to other individuals, including patients. So option choice C is not a great choice. Option choice D here states, send her on unpaid leave for 2 days. Now, there's two main issues with this. The first one is that the rest period is a little bit too short, and the second is that the contractual agreement between the dental assistant and the dentist determines the payment conditions. Now, this is not something that's currently set out or clarified by the CDC, so it's important to go by this contractual agreement. So D is incorrect here. That leaves us with A as the correct answer choice, to relieve the dental assistant from work for the next 7 days and then reevaluate next steps.
So question 66 asks, each of the following is a contraindication for implant placement except one. Which is the exception? So implants are very common when replacing missing teeth. It's a very invasive procedure, however, so you must go through a patient's medical history thoroughly, just like you would for an extraction. You want to prevent failure, surgery complications, or problems with healing. So option A reads current IV bisphosphonate therapy. So IV bisphosphonate therapy increases the risk of medication-related osteonecrosis of the jaw, which would slow the healing process and also cause exposed and necrotic bone. And this all leads to implant failure, so this would be incorrect. Option B reads myocardial infarction. So recent MI, as in within 6 months, is a contraindication for an implant. So you want to wait 6 months after an MI to start implant therapy. So this would be incorrect. Option C reads active chemotherapy treatment. A patient that goes through chemo is immunosuppressed and expected to have delayed healing and possible implant failure, so this would be incorrect. Leaving us with option D, diabetes mellitus. So having uncontrolled diabetes would be contraindicated for implant therapy because of the delayed healing. However, if a patient has controlled diabetes, this wouldn't be an issue and you can continue with implant therapy. So this would be the correct answer for this question.
What is the percentage of fluoride toothpaste sales in the US? So this question is asking us what percentage of toothpaste sold in the US are fluoridated. Fluoride is an important part of preventative care, and one of the most important forms of at-home topical applications of fluoride is through fluoridated toothpastes. Fluoride can help with preventing cavities by remineralizing hard tissues and decreasing demineralization of hydroxyapatite out of these same tissues, and this makes it more resistant to acid attacks. Out of all toothpaste sales in the US, 95% of those sold are fluoridated, making D our correct answer. While most toothpaste sold do contain fluoride, there are others that may simply be non-fluoridated toothpaste, or those that contain neem, which is a plant-based material that has been thought to be beneficial for oral health. Others may also choose to use toothpaste that contain nanohydroxyapatite, which have benefited in remineralizing incipient conditions. However, the ADA at this point in time recommends that patients use fluoridated toothpaste only and twice a day, as there is concrete evidence supporting the use of fluoride in preventive care. When looking for these toothpastes, it may be more effective when sending alginate impressions to the lab, which is the best option. Alginate is a dental impression material that tends to distort easily, making it better for a diagnostic cast or to make custom trays, and it's less often used for final impressions or impressions that need high accuracy. However, it is commonly used due to the low cost, fast setting time, as well as it being non-toxic or irritating. After alginate impressions are taken, we do have to be mindful that they have been in the patient's mouth, and there is a risk of transmission of diseases if we're transporting this impression to the lab. So this means that we ensure that infection control practices are in place, and this makes C our right answer, as it is the best option in this case. So after we take the impression, we should disinfect it. How this can be done is to first rinse the impression under running tap water. What this will do is it'll rinse out biological material and reduce the microbial load from the impression tray. After this has been completed, disinfection with sodium hypochlorite or another disinfectant is necessary to prevent cross-contamination. So let's take a look at our other answers quickly. Option A reads obtain patient's medical history, and this answer is incorrect, as this should have been done at the beginning of each appointment so that we review the patient's conditions and we know what to do in cases of emergencies. So doing this after taking the impression is too late. Option B reads extract all remaining teeth, and this answer is incorrect, as this is not the treatment plan for every patient. Option D reads obtain consent form for denture fabrication, and this answer is also incorrect, as in some cases this should have been done prior to taking the alginate impression. However, if this is a preliminary impression, consent can be obtained after the study models are poured up, but this is not the step that is the most necessary to do right after taking the alginate impression.
Question 12 reads, which should be done after a procedure that involves nitrous oxide to oxygen sedation? So nitrous oxide to oxygen sedation is the most used gas anesthetic around the world. It's safe, and we use it to help relieve anxiety and pain in dental patients. This question is asking, what do we do after administering the nitrous oxide to oxygen sedation? So option A reads, 100% oxygen should be delivered to the patient for 2 minutes. So while yes, it is correct that you should give 100% oxygen to the patient after sedation to prevent diffusion hypoxia, you need to give 100% oxygen for more than 2 minutes. The rule is administer 100% oxygen for 5 minutes, so this is incorrect. Option C reads, the patient should breathe ambient room air for 5 minutes before being dismissed. The patient needs to be given 100% oxygen for 5 minutes, or else they're at risk for diffusion hypoxia. When you rapidly eliminate nitrous oxide from the lungs after anesthesia, it's going to dilute alveolar oxygen, and that's going to cause diffusion hypoxia. So this is incorrect. Option D reads, the patient should breathe ambient room air for 10 minutes before being dismissed, and just like we said before, this is incorrect. Leaving us with option B, 100% oxygen should be delivered to the patient for 5 minutes. So as I said before, this is correct. The rule is you must administer 100% oxygen for 5 minutes after the procedure to make sure you clear out any nitrous oxide in the lungs so you can prevent diffusion hypoxia. So this would be the correct answer for this question. So question 35 reads, after caries excavation is complete, a pulpal exposure that is less than 1 millimeter occurs. What is the next best step? So sometimes during deep caries excavation, a pulp exposure might happen. What we do next depends on the size of the pulp exposure as well as the symptoms that the patient had beforehand. So option A reads, place zinc oxide eugenol over exposure. Zinc oxide eugenol is used for temporary cement and fillings, but not direct pulp capping, which is what we need to do for this situation. It actually causes irritation to the pulp, so this would be incorrect. Option C reads, place etch and bond over exposure. Placing etch over the pulp tissue will actually irritate it, so this would be incorrect. Option D reads, initiate root canal treatment. So considering the tooth had no symptoms and the pulp exposure was less than 1 millimeter, root canal treatment is not necessary, so this would be incorrect. Leaving us with option B, place calcium hydroxide over exposure. So the tooth has no symptoms and the pulp exposure is small, it's less than 1 millimeter, so a direct pulp cap with calcium hydroxide is the next best step. This is going to allow for a calcified barrier to form over the exposure, and there is no need for a root canal treatment. So this is the correct answer for this question. So question 3 asks, during the routine exam, the patient says he is experiencing chest pain for the first time. Which action should be performed by the dentist? So if you have a patient that's experiencing chest pain for the first time, you need to treat it as though they have myocardial infarction. So myocardial infarction, or MI, happens when there is one or more areas of the heart muscle that isn't getting enough oxygen, and that can happen when blood flow to the heart muscle is blocked. Essentially, it's a heart attack. Patients are going to feel crushing, squeezing chest pain, pain radiating to their arm, neck, jaw, or abdomen, and it's not going to be relieved by nitroglycerin. They're also going to have a cyanotic appearance, so that would mean bluish skin and lips, and they'll have weakness, cold sweats, nausea, air hunger, and an irregular pulse beat. So option A reads, place the patient in a supine position. Placing a patient in a supine position is important when treating MI. You want to make sure you put them in a comfortable position. However, that's not enough to treat the patient, so this is incorrect. Option B reads, wait 5 minutes and check vitals. This is a very serious condition, and waiting 5 minutes to check vitals is not a safe option. You want to take matters seriously as soon as possible, so this would be incorrect. Option C reads, finish the procedure quickly and dismiss the patient. Your patient is experiencing a dangerous medical emergency. You can't just continue treatment and send them home. You need to address the emergency because there are very serious life-threatening consequences for your patient. So this makes this incorrect. Leaving us with option D, activate the emergency response system. So again, our patient has chest pain, and that is associated with angina pectoris, but considering our patient has never experienced chest pain, you want to treat this as a severe medical emergency like myocardial infarction or MI until a proper diagnosis is made. So that would include placing them in a comfortable position, performing the ABCs, giving them aspirin, oxygen, Demerol 50 milligrams intravenously, and morphine 10 milligrams intravenously. So this would be the correct answer for this question.
Question 7 states, each of the following practices needle safety except one. Which is the exception? So here we're going to try and visualize the different answer choices and come to a conclusion based off of what we come up with. So looking at option A, it states disposal of sharps in sharps containers. Now, sharps containers are incredibly important as they reduce the risk of puncture wounds after sharps have been used. So because this is something that increases needle safety use, we can cross this off the list as it is not the exception here. Next, we're going to look at option B. It states use engineered needle safety products. So similar to how a safety pin is engineered to reduce the risk of injury, engineered needle products also have some kind of mechanism involved to reduce the risk of puncture wounds when using needles. Because this is something that does practice needle safety, we can cross this off the list. Next, we're going to look at something called the one-hand scoop technique, and this is a recapping technique when using needles. Now, when using this technique, one hand holds the needle and essentially scoops up the cap and tries to orient it within the cap, and then the second hand is then able to be used at the base of the needle stick to ensure that the cap is tightly sealed. Remember that the second hand is only used at the end of this step, and again, it is only used because it is used at the base of the needle stick. Now we can cross this off the list as it practices needle safety, unlike the final option choice here, which is called the two-handed needle recapping technique. Now this technique is opposite to the one-hand technique as it is using two hands instead of one and increases the risk of needle injury. Now, although one may think that using two hands essentially increases safety as there's more control over using the needle, it is actually not a good idea because, as you can see here, when one hand is pulled towards the other to recap the needle, there is a risk of injuring the second hand or thumb by using this technique. Therefore, we know that the two-handed needle recapping technique is not something that practices needle safety, and we can cross this off the list.
So question 91 reads, each of the following can be used in the treatment of a suspected pseudomembranous colitis except one, which is the exception. So pseudomembranous colitis is a severe inflammation of the inner lining of the large intestine, and it usually happens because of Clostridium difficile bacteria. So risk factors for this are antibiotic use such as clindamycin use, ampicillin use, fluoroquinolone use, and cephalosporin use. Old age, a weak immune system, history of pseudomembranous colitis, ulcerative colitis, or Crohn's disease are also risk factors. So option B reads vancomycin. This is not one of the antibiotics that we listed before, and it actually can treat suspected pseudomembranous colitis, making this incorrect. Option C reads metronidazole. Again, it's not one of the antibiotics that we listed before, and it actually does help treat pseudomembranous colitis, so this is incorrect. Option D reads fidaxomicin. This is also an antibiotic that can treat pseudomembranous colitis, making this incorrect, and leaving us with option A, clindamycin. And again, like we said before, clindamycin, ampicillin, fluoroquinolones, and cephalosporins are all drugs that are risk factors for pseudomembranous colitis, and they would not be in the treatment for suspected pseudomembranous colitis, making this the correct answer. Question 82 reads, what is the ASA classification of this patient? So real quick, the ASA classification stands for the American Society of Anesthesiologists, and we use this classification to help us understand the patient's physical status and preoperative risks. So looking at our options, option A reads ASA 1. Now this classification is for completely healthy patients who do not smoke or drink little to no alcohol. However, our patient had a myocardial infarction, also they're hypertensive and obese, so this would be incorrect. Option B reads ASA 2. So this classification is for patients with a mild systemic disease that doesn't cause any functional limitations. So this does include controlled hypertension and obesity. However, our patient has had a myocardial infarction 9 months ago. Also, their blood pressure indicates uncontrolled, so this would be incorrect. Option D reads ASA 4. So this classification is for patients with a severe systemic disease that is a constant threat to life. So that includes cerebrovascular accidents, ongoing cardiac ischemia or severe valve dysfunction, DIC, sepsis, end-stage renal disease, but not undergoing regularly scheduled dialysis, and myocardial infarction less than 3 months ago. However, our patient's MI happened 9 months ago, so this would be incorrect. Leaving us with our last option, option C, ASA 3. So this classification is for patients with a severe systemic disease that causes functional limitations. This can include poorly controlled diabetes, poorly controlled hypertension, morbid obesity, just like our patient has, alcohol abuse, end-stage renal disease, but with regularly scheduled dialysis, and history of MI over 3 months ago, just like our patient who had MI 9 months ago. So our patient's background and patient history aligns with this classification, making this the correct answer for this question. Question 104 reads, the patient's father will be paying for the treatment. Which is the next appropriate step? So here we have a 24-year-old male patient. His chief complaint is, I have a lot of dental issues, and his current findings include multiple carious teeth. So here we have a 24-year-old male patient. The age of the patient is an important factor to consider when it comes to consent. Option A reads, obtain consent for the treatment from the patient's father. So the patient is 24 years old, and this means they are responsible for taking their own consent, making this incorrect. Option B reads, both the patient and the patient's father should sign the informed consent. So regardless of who is paying for the treatment, since the patient is 24 years old and older than 18, they are responsible for their own consent, making this incorrect. Option C reads, encourage the patient to accept the more expensive treatment plan since his father will be paying. So this would be wrong and unethical, as you should not be trying to persuade a patient to take treatment solely on financial gain. So this is incorrect, and that leaves us with option D. Discuss the treatment and cost of treatment with the patient's father only after receiving the patient's consent. Like we said before, the patient is 24 years old, meaning they're older than 18, so they are an adult and they are responsible for their own consent. You must not discuss the treatment with their father unless the patient gives you that consent, regardless if they are paying or not. So this is the correct answer for this question.
This question asks which virus has the greatest risk of being contracted by a vaccinated member of the dental staff in a dental healthcare setting. As a dental healthcare professional, there are multiple precautions taken in order to prevent the transmission of bloodborne and respiratory diseases. These include engineering protocols, IPAC measures, and vaccinations. This question is asking specifically about the transmission rate after vaccination of the healthcare member. So option A here is hepatitis B, and this is a bloodborne disease that does have a high risk of transmission, so around 30% following a percutaneous injury. And because of this, it is considered a high risk in the dental setting, which is why a vaccination is recommended for all dental professionals. However, this answer is incorrect because the question is asking about transmission rates after vaccination. After vaccination occurs, and the vaccination is usually 2 to 3 injections over a 6-month period, the risk of transmission drops to nearly zero. So this is not the virus that has the greatest risk of being contracted in a dental setting. Next up, we have human papillomavirus, and this is more commonly known as oral or genital warts. This is not something that we generally have to worry about in the dental clinic as we take IPAC precautions, but even then, it is a highly preventable infection with the use of vaccinations. We have 3 vaccines in the US that are used to prevent HPV transmission, and those are Gardasil, Gardasil 9, and Cervarix. Then we have HIV, and this is something that is transmitted through bodily fluids, so there is a risk of transmission through percutaneous injuries or through needle stick injuries in the dental workplace. Now, although bodily fluids can be a source of transmission, such as saliva, blood does have the highest concentration of infectious particles, so we do have to be wary about percutaneous injuries or needle sticks. However, there is only a 0.3% risk of transmission when exposed to HIV, and this is prior to vaccination. So this answer is incorrect, as there is actually no vaccination available for HIV, and the risk of transmission is already pretty low without a vaccination. We're seeing here is 0.3%. However, if a percutaneous injury has occurred while treating an HIV patient, the risk of transmission can be reduced even further with post-exposure prophylaxis, and this involves taking 2 to 3 different antiretrovirals for around 4 weeks within the first 72 hours of suspected exposure. This leaves us with D as our correct answer, as hepatitis C does have the greatest risk of being contracted by a vaccinated member of the dental healthcare setting. Hepatitis C is the most common bloodborne disease of the liver in the US, and without vaccination, there is a 1.8% chance risk of transmission. However, since there also is no current vaccination for hepatitis C, much like HIV, the rate of transmission remains at 1.8%, which is the highest of all of these 4 options. If infected, there's also treatment, and that comes in the form of either interferon alpha weekly or ribavirin daily.
Question 29 reads, each of the following are common oral conditions associated with aging except one. Which is the exception? Aging has several physiological effects on our oral health that are important to consider when treating older patients. So this question is asking us what oral condition is not associated with aging or getting older. Option B reads xerostomia. This is common to see in an aging population because it can be due to a systemic disease like diabetes, which is often seen in older patients, or the use of multiple medications, which again is seen in older patients. So this would be incorrect. Option C is periodontitis. This is a common condition in the elderly and can lead to loss of teeth. So again, this would be incorrect. Option D reads root caries. This is also commonly seen in older populations because older patients are more prone to gum recession, and this will lead to an exposure of the root, thus an increased risk for root caries. So this would be incorrect. Leaving us with option A, Pitt and Fisher caries. Pitt and Fisher caries are due to harmful sugar-consuming habits like eating a lot of sweets, and is actually more common in young adults. So it's not a manifestation of aging, making this incorrect and actually the correct answer for this question.